Welcome. Thank you so much. Apologies for the slight delay. Before I introduce our moderator, I'd like to highlight our accessibility options today for today's webinar. Firstly, I wanted to mention this webinar is being recorded and should be available on CDC's YouTube channel in the coming weeks. For ASL Sign Language, or for American Sign Language, as you can see, we will be making that viewable on screen. For closed captioning in English, please access the captioning window outside of Zoom following the link being placed in the chat. Similarly, for closed captioning in Spanish, please access the Spanish captioning window outside of Zoom following the link that is also placed in the chat. Thank you. Now, it is my honor to introduce our moderator for today's event, Director of the United States Center for Disease Control and Prevention's National Center for Environmental Health, and the Agency for Toxic Substances and Disease Registry. Please welcome Dr. Aaron Bernstein.
Thank you so much, and good afternoon. On behalf of the U.S. Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry, I want to welcome you all and thank you for your collaboration and partnership over the past several years, as well as your participation in today's discussion as we work together to address cancer and environmental concerns, notably among children. Since President Biden reignited the Cancer Moonshot in 2022, CDC and ATSDR have made significant strides towards the ambitious goal of ending cancer as we know it. A few examples of the progress we've made to date include our updated guidelines for investigating unusual patterns of cancer and environmental concerns. CDC and ATSDR have also developed several frequently asked questions and other informational materials that inform communities and health departments on cancer, the environment, and environmental justice. And CDC and ATSDR have participated in various interagency meetings to work together towards understanding cancer and the importance of reducing risk of getting cancer in the first place. This work could not be more important. We know, based on evidence recently released, that cancer rates among young people worldwide have increased by 80% since 1990, with a 27% increase in cancer deaths among people in their 40s, 30s, and even younger. Last year, our own work at CDC reported that between 2003 and 2019, pediatric cancer rates across the U.S. increased steadily year over year. Cancers do not afflict all communities equally in our country. For example, leukemia, the most common form of childhood cancer in the United States, affects Latinos and American Indian and Alaska Native children about twice as often as Black children. For brain and other central nervous system tumors, the risks are for white children and American Indian and Alaska Native adolescent children are higher than for all other racial and ethnic groups. Incidence rates alone, of course, do not tell the full story of childhood cancer in our country. A Black or Hispanic child is much more likely to die from cancer than a white child. In recent years, the overall cancer death rates in children were higher for Black children, with rates that were substantially more as compared to white children in particular. As I mentioned, in 2022, CDC and ATSDR released new guidelines for investigating unusual patterns of cancer related to environmental concerns. These guidelines not only set forth a new approach to addressing concerns around cancer clusters, they also provide a new definition of what a cancer cluster means that focuses on evaluating cancers that appear to have similar causes. The guidelines also provide new criteria that help guide decision-making in the investigation of cancer and potential environmental causes. The guidelines emphasize stronger partnerships with community members and their advocates, as well with doctors This approach specifically calls out to the cancers that are on the rise, the differences we see in where cancers occur across the country, and perhaps most importantly, the differences we see with respect to age, sex, race, and ethnicity. What strikes me most, perhaps, at this time is the extraordinary investment we have made in understanding cancer from genetic and heritable causes. And in contrast, how much further we need to go to understand how our environments can shape cancer risk. So to move towards this vision, where no child in our country faces the future with cancer, we need new approaches. We need stronger partnerships with clinicians and academicians so that we train our medical colleagues in these realms and help address questions and concerns that will invariably land on their doorsteps from their colleagues and communities. We need to work with and provide support to our state, territorial, local, and tribal government health and environmental partners who are charged with keeping an eye on cancers in communities and in their investigation of cancer patterns that appear unusual. And last, but certainly not least, we need the partnership and voice of patients, families, and communities around the country, both in the community members themselves and in non-governmental organizations. I'm delighted to say that today we have voices that represent here with us each of these critical constituencies. Thank you again for taking the time to be with us for this important conversation. And I now have the honor of introducing our panelists. Before I do so, I want to make clear that while we may not have a lot of time, if any, to get some Q&A today, we did receive questions before this event, and those questions have been incorporated in the questions I will be asking of our panelists. You can also learn more about each of our panelists on the Cancer Moonshot website, the CDC's Cancer Moonshot website, but I will give them a very brief introduction here. Dr. Mark Miller is an associate clinical professor at the University of California, San Francisco, and director emeritus of the Western States Pediatric Environmental Health Specialty Unit at UCSF. He also serves as the lead for the Childhood Cancer and Environment Program at the PESU Network. Dr. Cliff Mitchell is the director of the Environmental Health Bureau in the Maryland Department of Health Prevention and Health Promotion Administration. Ms. Nsé Obot Witherspoon is the executive director of the Children's Environmental Health Network. Dr. Michael Sher is a molecular epidemiologist at Texas Children's Cancer Center and the Cancer Prevention and Population Sciences Program of the Dan L. Duncan Comprehensive Cancer Center at Baylor College of Medicine. Ms. Charlie Smith serves on the advisory board for Trevor's Trek Foundation. She has been an advocate for pediatric cancer since 2002, when her son Trevor was diagnosed with brain cancer at the age of 13. Dr. Marcia Wills Karp is the chair of the Department of Environmental Health and Engineering at the Whiting School of Engineering and the Johns Hopkins Bloomberg School of Public Health, and the Anna M. Bacher Professor of Environmental Health and Engineering and a Bloomberg Centennial Professor. So to start with, I'd like to ask Ms. Smith to start the discussion. And Ms. Smith, if you please, I'd like to ask you about your perspectives as a mother of a child diagnosed with cancer and questions you and other community members have had.
Thank you, Dr. Bernstein. And I'm a Caucasian woman with blonde hair and wearing a black blazer. I'm honored to be here today, and I want to thank everyone on this panel for the wonderful work you are doing on cancer and the environment. Tell you a little bit about my story. The 4 words no parent ever wants to hear are, your child has cancer. My son Trevor was diagnosed with brain cancer in November 2002, 1 month after his 13th birthday. Trevor was a very athletic, healthy boy. One minute, I was watching my son play football for his 7th grade team. The next minute, I was watching him suffer through his radiation and chemotherapy treatments. I was sure my son was going to die. Unfortunately, Trevor was not the only child diagnosed with cancer in our small tourist town of only 1,700 full-time residents. The community was concerned that there was something environmental contributing to the high numbers of cancers. I was concerned as well and began looking into what could be causing this unusual pattern of cancer. I approached the state health department and the Idaho Department of Environmental Quality looking for answers. I was told that due to the small population of my town, it didn't warrant a cancer cluster study. We were statistically insignificant. I took my concerns elsewhere, only to be told that I was acting out of emotion and that I was on a witch hunt. I felt helpless, scared, and angry. These emotions put me on a path to do my own investigation. I wanted answers. Communities around the country are impacted by environmental exposures and cancer clusters. They want answers too. Families and communities are reporting health issues to their local and state health departments, but many times their requests are not taken seriously and they are told that nothing is wrong. Trevor vowed that if he survived cancer, he wanted to help other communities. Yeah. Who are sickened by toxic chemicals, so no other children have to suffer from the bully cancer. Trevor is 34 years old now and committed to helping others. Communities around the country are impacted by environmental exposures and cancer clusters. They want answers too. When Trevor vowed he survived cancer, he wanted to help other communities sickened by toxic chemicals so other children don't have to suffer from the bully cancer. Trevor is now 34 years old and committed to helping others. When Trevor's Law was signed into law as part of the Frank R. Lautenberg for the 21st Century Act on June 22nd, 2016 by President Barack Obama, families felt they had a lifeline for better investigations of environmental causes of unusual patterns of cancer. Trevor's Trek Foundation is contacted regularly by communities asking for help. They are worried and frightened about their high rates of cancer resulting from environmental pollution and corporate negligence. These communities include Montgomery County, Pennsylvania, Franklin, Indiana, Sparta, Wisconsin, West Salem, Virginia, and Taylorville, Illinois, just to name a few. Some of these communities and their schools are located near Superfund sites, many of which have never been cleaned up. Environmental justice is long overdue. Can where you live make you sick? Yes, it can. Thank you.
Thank you so much, Charlie, for sharing your and Trevor's story. Next, I want to turn to Dr. Miller. Dr. Miller, could you please speak to your experience as a clinician working at the intersection of environmental health and cancer?
Thank you. Research, I'm a balding white male with glasses, a red tie, and a gray tweed jacket. Research in the last 25 years has greatly expanded the understanding of risk factors related to childhood cancers. Identified risk factors for childhood leukemia and some other cancer types include exposure to pesticides, traffic-related air pollution, solvents, tobacco, and other things. There are also protective factors for childhood leukemia, including breastfeeding, adequate folate early in pregnancy, and attending daycare centers. Clinicians report that though they regularly get questions about environmental exposures from their patients, they have little or no training about this, and most report being uncomfortable answering these questions. Only about 6% say that they had any training in taking an environmental history. Fortunately, nearly all respond that they would like to know more. The Pediatric Environmental Health Specialty Units, the PESUs, are a national network providing education and consultation for both health professionals and communities about environmental exposures during pregnancy and childhood. Our approach to improving clinical knowledge and to support addressing childhood cancer in the environment has been multi-pronged. We developed curriculum and directly trained our own PESU staff, pediatric hematology oncology fellows and nurse practitioners, as well as community health workers and promotores de salud on current research and ways to put that information into practice. We have created a wealth of educational tools, including social media and training videos, fact sheets, multimedia ebook, and more. Things that we've learned in this process include that we need to improve clinician knowledge and awareness about environmental contributors to childhood cancer. Clinicians want just enough of a review of science to support that there is a sound basis for including environmental risk factors in discussions. And then what they really want is clear action items that they can implement in practice. For example, research suggests an increased risk of hospitalization for respiratory illnesses in childhood cancer survivors and that are exposed to higher levels of particulate air pollution. Learning how to provide guidance on the use of the air quality index and home HEPA filtration, for example, provides clinicians with a way to translate the research into daily practice in a survivorship clinic. Increasing the very limited funding for research that will uncover environmental risk factors will allow us to not only improve outcomes, but to prevent childhood cancer in the first place, which is, of course, what we all want. Thank you.
Thank you, Dr. Miller. Dr. Mitchell, may I ask you to please share your perspectives from working at the state level?
Thank you, Dr. Bernstein, and thanks to the CDC for hosting this important event and to my fellow panelists. I've been here at the Maryland Department of Health. I am a white male physician wearing a pink tie. I've been here at the health department since 2006 and involved in responses to unusual patterns of cancer since about that time. I think it might be helpful to explain a little bit about how it is that we go about thinking about cancer when a question comes into us from the public, which is very often, we often have more than one question a month that comes into us about, is this pattern of cancer in our community unusual? And some of my most frustrating and challenging experiences in the state health department have been from those questions. I'll give you an example of how we approach these, working hand in hand with our Maryland Cancer Registry, our Center for Cancer Prevention and Control, our Department of the Environment, local health departments, and the community to try to address what is often a complex question. Some of the challenges that come up involve figuring out exactly, for example, what are the questions that are being asked by the community? Is it about one cancer? Is it about a group of cancers? How big is the area that people are concerned about? Is it an entire town? Is it a neighborhood? And oftentimes this involves repeated multiple conversations with a community or a group of communities together. Sometimes it's a workplace. In every case, you have people who are legitimately concerned, worried, anxious. I've heard the words of Ms. Smith, and I've heard those words many times from members of the community who are asking, can you please help us understand how this happened, why this happened, and is it something we need to worry about for our other children in the community? So the CDC's original publication of these guidelines helped us a lot as states to try to answer these questions. What we found with the new guidelines is they help us think more systematically about how do we look at both the questions of the cancer and potentially exposures in the community that can be prevented, even if we can't provide a completely satisfactory answer to how this thing happened. We can sometimes help communities to understand what are the exposures that they are concerned about and how can we prevent those exposures in the future. So in closing, I would say it's a complicated set of questions which involves more than anything else listening to the community, hearing what it is they're trying to tell us, and thinking about how we move from just answering the question, what are we experiencing now, to how do we prevent this from happening in the future?
Thanks so much, Cliff. Next up is Dr. Wills Karp, who will add into our conversation the perspective of someone who's worked in academia and has really led an organization that is working to develop community trainings on this topic. Dr. Wills Karp.
Thank you, Dr. Bernstein. I'm Marsha Wills Karp. I'm a Caucasian woman with glasses, red shirt, and black jacket. Thank you also to the fellow panelists and to Ms. Smith for sharing her experiences with us. As you've heard, and many of us know, individuals around our country are exposed to chemicals in the environment such as radon, asbestos, arsenic, airborne particulate matter that may contribute to the risk of our children and ourselves to develop cancer. And unfortunately, many of these exposures are disproportionately borne by communities that have experienced structural racism. So our goal here, I think, is to protect, and as Cliff said, to prevent cancers from developing. And we need to mount a coordinated effort between academicians, physicians, government agencies to inform individuals of potentially harmful exposures and risk of disease in their communities, and also to promote legislation to prevent these exposures. I think that academics can contribute significantly to this goal in several ways. First, we can provide guidance to communities on how to access and utilize existing information regarding exposures in cancer risk. Many do not know where to start to gather this information for their communities. And our team, led by Megan Latshaw, is working with CDC to create a training module on environmental health tracking for community members. The purpose of this training will be to help people access data that the CDC houses and other public agencies house. As this may be overwhelming to new users, and often we're not aware of how to use these tools, this course is designed to help everyone across the board, but particularly community members, to understand how to access and utilize this information to protect themselves and to advocate for their children. The audience for this training will be communities concerned about exposures, health professionals as well, who may not be up on the latest environmental health data, and physicians, and it'll help them use the CDC's environmental health tracking data. Secondly, academicians can provide real-time local data exposure for communities, for clinicians, and government agencies. Academic groups across the country have the expertise in monitoring and measuring a variety of environmental exposures in order to provide their local communities and other stakeholders with the data and start to generate the evidence linking these exposures to health outcomes such as cancers. As an example, our team, led by Dr. DiCarlo, recently utilized a mobile van, which we have set up with very state-of-the-art equipment to determine toxic gas levels in Louisiana. And the particular gas is ethylene oxide. We surprisingly found that the levels were 10 times higher than those that have already been associated with cancer in the past. So previously, there were no measures of this toxic gas to inform workers, families, and communities who are living nearby what their actual risk is based on this exposure to these chemicals. Thirdly, I think academicians in partnership with other stakeholders and communities are leading the fundamental science that will allow us to understand how these environmental exposures lead to development of cancer and hopefully to start developing therapeutics to intervene and to treat these environmentally related cancers. And lastly, we need to build trust with communities, and that's critical to mounting an effective public health approach to prevention of cancer. An example of a successful approach is when we're engaged in through a National Institute of Environmental Health funded center, which we call CHARMED for Charm City, Baltimore, where we're based, in which we work directly with communities to address their environmental concerns. This is a unique center that instead of us going to the community and saying, we want to collect X data, we go to them and say, what are your concerns? And how can we help you to gather data to help you to advocate for yourselves? So a recent example of the success of this, we've been working with the community to bring awareness to the exposure to coal dust in the South Baltimore communities. And this recently led to the U.S. Congressman Representative Mfume, who in a recent congressional hearing called for federal aid to help curb coal pollution. So we worked with the communities to provide evidence of the exposures and to engage with local and federal lawmakers. I'm happy to discuss in later conversation at greater length any of these efforts or partnerships that can be built around the country to empower communities to get the information they need and to advocate for their health and overall to prevent cancer. It's one thing to treat cancer, but we really want to strive to prevent cancer from developing to begin with. So thank you very much, and I'll stop there.
Thank you so much, Dr. Willis Karp, for those insights around your work in communities and in your work in academia. Next, I'd like to turn to Dr. Sher. Can you please share some of your experiences from your work in academics and clinical settings?
Sure. Thanks for having me. I'm a Caucasian male wearing a khaki jacket. Thanks again for everyone for today. I want to share some new work that we're doing in collaboration with Dr. Miller and the PACU networks to really address the concerns of the families who are come to our cancer center for care of their children. As Ms. Smith shared, one of the first things that we often hear from families is, why did this happen to my child? And is there something in around my home that could have caused this? And as Dr. Miller pointed out, many clinicians either don't have the knowledge or don't feel comfortable trying to address a lot of those questions. So one of the things that I'm working on with one of my clinical collaborators is the development of a referral service whereby any of the clinicians who engage these questions from our families can turn to and provide knowledge and consistent information to answer the questions that families have about exposures to environmental toxicants and how they may have contributed to the development of their child's cancer. One of the first things that we've done is we've engaged our family advisory council for the cancer center to ask them, do you think this is a good idea? How should we go about doing this? And there was an overwhelming yes and enthusiastic support from that committee saying that this is definitely something that they want and that they feel is needed. One of the moms in particular said the first thing she did was start Googling things. And that was probably the worst thing she could have done because there's so much information available, some of it true, some of it not so true, So she would love to have a place to go for reliable information about what may have contributed to her child's cancer. So we're in the very early stages of establishing what this would look like, but we hope that will be a model that other pediatric cancer centers across the United States can pick up and move forward to be able to address concerns from families as they arise with consistent and information that's backed by scientific evidence.
Thank you so much, Dr. Sher, for sharing that important work. I'd like to ask Ms. Obut Witherspoon to close this section of our session to speak about your work in a non-governmental organization that supports communities at increased risk of childhood cancer.
Thank you so much. Really a pleasure to be here with all of you. I'm an African-American woman with black hair, brown eyes, and I'm wearing a beige blazer today. I'm the executive director, again, of the Children's Environmental Health Network, also known as CEHN. We're the only national nonprofit of our kind, also working at the global level for 32 years now to protect all children from environmental harms and the rising threats of climate change. Science and lived experiences, as we've been talking today, have shown that over decades, the last couple decades, we have been exposed in particular to a range of chemicals in our daily lives, many of which are known carcinogens. These chemicals are found in the products that we use daily, the air that we breathe, the water many of us rely on, the agricultural systems that produce our food supply, and in our built environments. And if you look at where children spend a majority of their time, it tends to be homes, early learning childcare facilities, K-12 schools, and eventually places of their future employment. Acknowledging this link to various cancer risks is critical to our collective pathway forward. This paradigm shift goes well beyond lifestyle, behaviors, and genetics. It relates to harmful exposures that we need to significantly reduce our exposures to, breaking the cycles of harm. Over 8 years ago, CEHN became a long-standing leader in the Cancer-Free Economy Network, which is working to advance cancer prevention from environmental hazards as we consider the economic dependency that connects to many industries and products that increase our risk to cancer diagnosis and other long-term illness. I'm the co-lead of the health science node of the network with the Silent Spring Institute and the Alliance of Nurses for Healthy Environments and the University of Massachusetts at Lowell. Our partnerships and collaborations have been critical. We produced a joint statement on cancer prevention that has been signed by leading associations in public health, medicine, nursing, and cancer-focused organizations. It is the first resource of its kind to inform the leadership of these groups to gain an increased understanding of their connections and their work, and encourages each of them to advance education among their members. When it comes to childhood cancer, CHN is a leader in the Childhood Cancer Prevention Initiative. We use a multidisciplinary approach to including the leadership of childhood cancer organizations, sustainable business leaders, public health organizations, health professionals, impacted families, and researchers. We have produced a report called the Childhood Cancer Cross-Sector Strategies for Prevention that reviews a range of available peer-reviewed science publications and shows trends of childhood cancers associated with exposure risks to certain forms of pesticides, air pollutants from vehicle emissions, paints and solvents, which generally are from occupational exposures. Another member, the American Sustainable Business Network, has written a business case for safer alternatives to fertilizers and pesticides, which helps their members understand the urgency and opportunity to reduce their dependency on the use of pesticides and consider alternatives for use in materials, supplies, and operations. Another leading partner in the network, Prep for Gold, leads the planning of the National Childhood Cancer Prevention Symposium. The inaugural one was held this past fall in Washington, D.C., and the next one is slated for February 2025 in Texas. This is a unique and important place for advancing opportunities and priorities within our call to action, such as the need for a robust childhood cancer prevention research agenda, as we work to champion for the prevention of childhood cancer, and we invite you all to join us. Thank you.
Thank you so much, Ms. Obut Witherspoon. I now want to transition this conversation into some questions that are your questions. These are questions that came to us prior to today's session, And I'm going to pose these questions to each of the panelists, and depending on how much time we have, we'll see how many questions we can get to. The first set of questions has to do with how we can enhance our collective understanding of environmental causes of cancer, and I'll pose it to Dr. Mitchell. What do you think are the major gaps in understanding how environmental factors may contribute to cancer, and how can we better promote the practice of being proactive in monitoring of cancer data and better engage our clinical and academic partners?
Thank you, Dr. Bernstein, and I'll try to be brief and thorough at the same time. The first is we do have tremendous challenges, and I want to say we've got tremendous resources in our state health departments, both in our cancer programs, our cancer registries, and in our environmental health units. But one of the things, there are a couple of things that I think that could significantly improve how it is that we work. First, I do want to point out cancer registries are one of the treasure troves of useful information, and often not appreciated for all the important work they do, not only in understanding cancer as a disease, but also what potential contributing factors there are for cancers. Some of the things that we need to think about are, how do we better link exposure and exposure information to cancers? And for that, we need more information both within cancer registries and working with academic partners, our departments of the environment, understanding of how we make those linkages between exposure and cancer. Another thing that we really need to think about, and I want to give a lot of credit to the CDC for thinking about our basic understanding of the biology of cancer and its relationship to various causal factors. The more we know about that, the more we are able to talk about potential links and the absence of potential links when they occur. The other thing I think that's really, really important is on the risk communication and communication outreach side. You know, we have talked here in Maryland about the importance of, when we get these engagements with the community, how do we ensure that we reach the community as a whole? And how do we present the information in a way that is meaningful, useful, and where we admit what we do not know and cannot answer? Because I think some of the frustration for both communities and for us as well occurs when there's uncertainty. And there's almost always uncertainty in these questions. So sometimes we are left with, we think that there's a possible exposure. We can't say for sure whether your cancer was caused by this, but we can say that we can fix this exposure moving forward so your community will be safer. If we can think more concretely about those kinds of needs and issues, I think that will help all of us.
Thanks so much, Dr. Mitchell. I want to turn next to Dr. Miller with this question, which is, what are the lessons learned from the recent clinical partner survey research and clinical trainings around cancer and the environment that can be applied for raising awareness around these issues?
Yeah, thank you, Dr. Bernstein. Well, our Childhood Cancer and the Environment program started with a year-long project to develop champions at each of the 10 PACEs, who then became the regional go-to authorities for clinicians. Then the champions participated with our staff of eminent researchers when we conducted 2 day-and-a-half-long workshops for 40 pediatric oncology fellows and nurse practitioners from around the country. 3 months after the workshops, 80% of the attendees said that they had made changes to their clinical practice. 55% said they had shared workshop materials with their patients. And 86% said that their perceptions regarding environmental health risks and childhood cancer had changed because of the workshop. I love these comments. One was, I have a lot more respect and consideration for parental concerns about environmental factors. This is from a clinician. And in other words, for newly diagnosed patients, I do a more thorough history to look for environmental exposures and possible correlations between patients in similar areas. Through this experience, we've learned that pediatric hematology oncology clinicians are actually excited to learn about the science identifying environmental risk factors, and will put that knowledge to use. Clinicians want more information, particularly about resources that they can use to make available to patients on methods for exposure reduction. And we also learned that holding an off-site retreat in a setting that promotes reflection and group interaction really works well. Subspecialists like oncologists have an important influence on curriculum content within medical training, and thus provide a way to help environmental health to be integrated throughout training years. Some clinicians have, over the years, spoken to a concern about discussing environmental risk factors, that will create guilt in parents. Here's a parent perspective. It didn't sit well with me that no one on the staff of the hospital, a top cancer hospital in the United States, asked any questions or gave any specific environmental advice during or after treatment. I was left to do my own research. Parents have largely been very supportive of this program, as Michael had noted from his advisory panel. I think it's my belief that done well, working through these questions with families can actually reduce guilt rather than to increase it. As part of our program, we designed an interactive session to help clinicians improve communication about environmental health and to decrease implicit bias in healthcare. Thank you.
Thanks so much, Dr. Miller, for sharing with us that program and those results that really show great promise in making these issues more visible to providers. I want to switch gears now and ask some questions about how we can partner better and accelerate our work of preventing childhood cancers that may result from environmental causes. And to start that, I want to turn to Dr. Wills Karp and ask you, Dr. Wills Karp, from where you sit in academia, how can our scholars embedded in universities work better with the public health officials, clinicians, and community members in addressing concerns around cancer and the environment and building the kind of trust that's needed to help us move forward?
Thank you, Dr. Bernstein. I think I covered a little bit of that in my earlier remarks, but I'd like to just punctuate what's been said by my colleagues here. Is I think partnership and communication is the key. The academic community is learning daily about the role of the environment in different diseases, including cancer. And we need to come together as different stakeholders to share that information and be sure that both communities and physicians are aware of the latest information. As academic partners, we can work with our medical school colleagues to ensure that this type of information gets embedded in the medical training and in continued education of physicians, particularly pediatricians who are seeing children early in life and need to be conveying information about how to avoid and protect themselves from various exposures in their communities. And as someone said earlier, there are many things we're exposed to, from your beauty products, the things that you're using daily in your life. We need to be informed about these. And the only way we do this is to come together as various communities to communicate as broadly as possible these potential threats to our health. And I think academicians can certainly lead these, but we will need CDC, local health departments to come together with us to reach out to our communities. I think also, as academicians, I would like to say that we need to train the next generation of academicians to be able to communicate with communities, and in a way that communities are trusting of them and understand the information that they want to convey. And we are trying to do just that in our center, is training a new generation of academicians that aren't only focused on generating new fundamental science, but learning how to work with communities and how to be effective at communicating the needs of the community and addressing them. And I gave you an example of the partnership that we have at the moment, and that is working extremely well. It has taken many years of building trust with our communities, but I think they understand now that we are there for them, and we will do what we can do to promote their concerns, to provide them with information, and to advocate with them when necessary at the government agency level to enact new legislation that will protect the health of all of us, particularly our vulnerable children. So I would hope that this is the first of many of these types of get-togethers to provide communities and to bring us as different partners together to begin really strong interactions and communication for the future. So thank you.
Thanks so much, Dr. Wills-Karp. I'm mindful that we have about 3 or 4 minutes, and I'm going to try and get in a couple more questions. I'd like to ask Dr. Sher, how can we do more to expand our ability to listen and understand the needs of patients and families, and do that in a way that really ties it to what we understand around cancer and the environment?
Yeah, this is a critical question. Thanks for that. I think there are a couple ways that we can go about this. One, we have to continue to advocate for research, because when we say childhood cancer, we're not talking about one disease. We're talking about a group of diseases that each have their own risk factors. And I think we need more research in understanding which environmental exposures are contributing to each of these diseases that we're talking about. I think in order to answer your question a little bit more pointedly, I think we have to talk with our families. We have to understand, what do they want to know? How do they want to receive that information? And when is the best time to deliver that information to them? And that was those points came up when we started talking with our family council. Some parents want that information immediately after diagnosis. Some of them don't want it immediately. They want a little bit of time to pass so that they can understand everything that's going on with their child's medical care first, and then explore the questions that they have about, potential environmental risk factors. Some of them want this information that they can read on their own. Some of them want to talk to someone about it. So I think we have to talk with our families to understand better the information seeking that they have, and how we can best approach that information, put that information in front of them.
Thanks so much, Dr. Sher. I want to turn now to Ms. Smith. I wanted to ask you, in your journey of addressing environmental risks in cancer, you've had to deal with health officials, clinicians, academic partners. What would you say that we can do to make those collaborations better from your experience?
Well, I think I mentioned earlier, but the key word here is trust. We've brought that up now, and that's a big factor with families, with the communities, and reaching out to their local health departments, because even though we've made progress, I hear many times from a lot of these mothers and fathers that when they go to the health department, they're basically dismissed, especially when there's an environmental issue involved. And I think we could have the health departments could do take more action and more of an interest in the environmental factors that are contaminating these communities. But I think it's just something that, so these families, they don't have trust in their local health departments. And I think that's a big hurdle that we still need to conquer. And I think once these communities, these families can gain the trust of the health departments, that they really care, because they feel that health departments really don't care. And maybe it's due to, a Superfund site that's there, or a corporation that is a known polluter, and they don't want to get involved in that. And these are the things that I'm hearing from the parents of children who have been diagnosed with cancer, and where there's an unusual pattern of cancer. So I think trust is something we really need to overcome.
Thank you so much, Ms. Smith. I appreciate your experiences being brought forward and speaking to how we can work better across a wide group of people who are involved in working on this puzzle. And that brings me to the last question for Ms. Witherspoon. And this question really, I'm asking you to speak to what do we need to do to facilitate the kinds of partnerships that we've been discussing here today across the voices we have on this panel that can really, both contribute to reducing risk, but also supporting impacted communities directly.
Yes, thank you. And there's been some really helpful advice given already that I wholeheartedly support. Increase education and awareness, right? There's nothing that can really get in the way of that. We have to be able to hear each other out, understand that a lot of our healthcare professionals are trained in treatment. That's just what it is, right? So we have to have opportunities for them to also understand much further upstream, if you will, that we say in public health often, the preventive strategies. So we all have a part here, but we also have to show some grace and expecting that every sector is going to understand the world that I live in is not realistic. So for example, the Cancer-Free Economy Network's health science leaders have been working for a few years now with cancer-focused hospital centers, such as Dana-Farber Cancer Institute and Columbia University's Cancer Center, to put on first ever public-facing environmental health symposium. And as you heard, that also has been happening in Texas with Dr. Miller's trainings recently. And I would also say that the state cancer plans offer another opportunity for these collaborative partnerships. They don't open up every year, but when they open up, it's an opportunity for public health, health professional, cancer-focused organizations, and those that care about these exposures to make sure that the environmental health exposure data, environmental health risks, child health indicators are definitely not omitted, but very much incorporated in what each state is looking at as far as accountability, as far as what they're funding when it comes to not just treatment, but also the prevention opportunities in cancer diagnosis and other long-term illnesses for that matter. We've also engaged very well with Dr. Miller's training that he mentioned. And again, I've seen firsthand this transformational opportunity. I think that's yet another model to make sure that we're going to where providers are, going to where treatment specialists are, allowing them many on-ramps, right? Continuing education, grand rounds, whatever it is, because in the rooms that I sat in, which were many, everyone was transformed. They wish they had this information earlier, and they were very much turned on in thinking about how they could go back to their respective institutions and talk about change. I'll also support the child health parent advocates here because many of them are also in our networks, and as we're hearing today, and what they want, for example, are to make sure that on the survivorship teams, there is someone trained on environmental health awareness and education. So they're getting a lot of great support, dance, art, therapy, but no one to help them in this transition back to the home environment. And what about the rest of the world? And as was mentioned, there are many other children in these families that they also want to protect. And then finally, I'd also say that funding, right? We need to ensure that funding does not go exclusively to cancer treatment, where the vast majority of it goes. We really need to make sure that this notion of childhood cancer prevention and or cancer prevention research get some support, because again, we have a lot of lived experience happening out here, but it's not translating into actions that are also preventing harm. So the last thing any of us want to do is perpetuate these cycles of harm. So Dr. Bernstein, my answer in summation is that these interactions, the way that we're intentionally coming together, the way that we're breaking down silos, the way that we're giving each other grace to understand my background and my lived experience is not necessarily going to be my brother and sisters, but more importantly, how we all want to get to the same place. How do we hear each other out and make sure that we're collectively identifying the resources to get there and not on the backs of those that have harmed and been suffered the most.
Thank you so much, Ms. Oba Witherspoon, for that wonderful summation. And I want to also turn now to thank all of our panelists. You know, I've been in the field of pediatrics my entire career and taking care of many children with cancer. And it is conversations like this that give me hope that we can move towards a future where we don't see rising rates of cancer in our children or anybody. I'm particularly grateful for the perspectives that each of our panelists brought, such tremendous depth of experience. And I'm grateful also for everyone present today and all those who are going to be watching this moving forward for both being present, but also giving us your questions. As I mentioned, we used what you told us, not only for the purposes of structuring the questions I was able to ask today, but those questions also help us understand where your minds are on these issues and absolutely will help shape our work at CDC and ATSDR moving forward. I'm mindful that there was a very strong emphasis on environmental justice and health equity in your questions, and those are foremost concerns of our work at CDC and ATSDR. I want to also make sure that I thank the folks in the White House who helped organize today's event and bring us together. And with that, I want to wish everyone a great rest of your day. Thank you.
Thank you.